More than 2 years into this pandemic, and once again, we have a local public health agency opting out of offering public health advice. In their latest monthly meeting, which was held Friday, and with school is about to wrap up for the year, Central District Health Board decided to revisit plans put in place to keep COVID-19 from spreading in the classroom, discuss what worked and kind of what didn't. Of course, people have tended to play a little loose with the definition of what works during the past 24 months. So when CDH, which covers Ada, Elmore, Boise, and Valley counties, posted the agenda for last Friday's meeting, a discussion and vote on community masking and vaccine guidelines, well, you just knew it wouldn't happen without some sort of interesting discussion. Quick reminder of who sits on that CDH board. There's lawyer / career politician / candidate for state attorney general, former Congressman Raul Labrador, appointed by Ada County Commissioners after board member Diana Laciando lost the election to keep her spot on the Board of County Commissioners. There's also Dr. Ryan Cole, a pathologist and the lone physician on the CDH board, who has been controversial, to say the least, and widely criticized for his calling the COVID vaccine fake, needle rape, and the cause of cancer, which has been routinely debunked. Well, in this meeting, they decided any information CDH wants to put out to the public regarding kids and COVID, it's got to go through the board first. But they spent a good chunk of time talking about masks and kids wearing them to stop the spread. CDH Director Russ Duke, he chose to bring up some peer-reviewed studies from medical journals rather than entertainment journals, as he called them.
There is evidence to show that masking in general in crowded public spaces, including schools, during high transmission does reduce the infections of COVID-19. I guess the policy part for the board is to determine, is that something that you would essentially want us to stay silent on, because CDC recommends masking in schools today, and with kind of the qualifier of what are the transmission rates in the community.
So basically, they were trying to decide if they wanted to keep a mask recommendation when it comes to COVID spread in kids on their website and with their communication with the area schools. You know, a public health district helping spread public health information per CDC guidelines.
But I think we're in this odd scenario in terms of misinformation and disinformation coming from our own federal agencies. And it's very frustrating as a scientist that we're even having to have this argument when there's zero evidence that it's an intervention that does anything whatsoever.
So the masks have a little bit of benefit and do a lot of damage. And it's damaging our children. It's damaging their future. If we are really serious about public health, it's our responsibility to remove those things that are affecting our children, not to keep encouraging it.
My concern is if we follow CDC recommendations, we know that the CDC has been publishing false data.
The CDC has been publishing false data. By the way, joining remotely, that was Dr. Ryan Cole, joining the meeting from London, England, apparently continuing his world anti-COVID vaccine tour. Next stop, by the way, will be in Florida and then Texas. In the end, the board agreed with Labrador and Cole and voted unanimously to remove any masking recommendations from its website. The others apparently decided it wasn't necessary anymore. However, they did decide to post a link to the CDC's website for anyone looking for information about masking. Oh, there was a lot more said during Friday's meeting, including how the board was going to handle vaccine language going forward. We're going to try to dive into that shallow pool tomorrow.